Hi there, I'm Mabel Jung. Thanks so much for watching. We're at the World Healthcare Congress Interview Zone. I'm very pleased to have Jay Ethridge in the chair right now, and he's with IPG. Jay, it's so great to see you.
Thanks, Mabel.
So tell me about IPG.
Yes, Mabel, we're actually a device benefit management company. So it's actually a very young, emerging, industry that's forming. It's really part of the larger benefit management industry. You may have heard of pharmacy benefit managers, radiology benefit managers, and really what we're out to do is to provide, really management and structure around the implantable surgical procedure market.
Okay.
So that's really what IPG does.
Now, are you finding that you're having different kinds of conversations today with people based on what's happening in the healthcare sector in general?
Oh, sure. I mean, I think there's clearly a strong focus on affordability of care and quality. And so our solutions and the things that we're trying to bring to the market is clearly trying to align with what the new market needs really are. And so that's where we've really spending a lot of time with the market and understanding what they're looking for in terms of specific solutions and making sure that we're aligning the things that we can bring to the market to actually help providers, help health plans, and help physicians actually.
Are you finding that you're having conversations about trying to create networks with these different entities that do different things?
Absolutely. I mean, there is a spirit of collaboration that's forming, and so we kind of work between the whole genesis of the health plan, the providers, the physicians. So we interface, and we also interface with patients as well. So we try to create solutions that create some win-win-win type scenarios for all those stakeholders involved. It's a difficult task, but there are clearly opportunities to do that.
Is the picture getting more clear as to what America's healthcare system is really going to look like? I mean, I hear a lot about it's still a work in progress, we're still trying to figure things out, but in your mind, what do you foresee?
Well, I think people realize that things do have to change. So I think there's no more, can we just stick to what we've been doing? I think there is a conscious understanding that things do have to change, that the folks that are paying the bills and consumers are really demanding more from the healthcare system. So I think all the constituents involved in delivering healthcare right now realize things do have to change. So how that's going to look like is taking some shape right now. Nobody's trying to upset their whole business model right now, because obviously they have to run their business, they have to continue as an ongoing concern. So as they're looking at new payment models, new accountable care types of situations, they're clearly testing the waters and trying to understand how do we interface in that type of environment, and how does that affect my business. So I think once they have a better understanding, and they're probably pretty close to getting to that point, once they get to that point, then I think there will be more scale and there will be more momentum behind the changes that will take place.
Will consumers be able to tell the changeover is happening, or will there be a lot of confusion in the meantime about how it's going to be for them?
Yeah, I think I don't think it's going to be transparent so much to the consumer. I think at the end of the day, the healthcare providers have to take care of the patients as best as they know how, and they're trying to insulate the consumer from some of these changes that are taking place. There are some structural changes that are happening. Will there be some problems with claims and some other administrative situations that may come up as part of that may disrupt consumers? I think they will experience probably some of that, but I think it's manageable, for the most part.
What was your talk about to the audience, your presentation?
Yeah, so my presentation was really about improving cost, transparency, and quality metrics in the healthcare system.
Mm-hmm. And what was your message that you left to the folks that were present?
Yeah, so I think a lot of the messages that I tried to deliver was really around some of the strategies that we're trying to deploy to improve that, because I think some of the things that the healthcare system needs is they need better standards around cost and understanding what costs really are, as well as starting to define what quality really means. And quality can run the gamut as far as, is it around the quality around how bills and claims are processed? Is it quality around patient satisfaction? Is it quality around clinical outcomes in terms of what do patients, can they expect from a specific therapeutic treatment that they undergo? So I think there's a good dialogue around, well, what should be measured, and what are some of the current challenges that we have today that we've got to create the right kind of standards that will help facilitate being able to provide better information, more transparency to really all the stakeholders in the healthcare system.
Okay, Jay Ethridge, thank you so much for your time today.
Thank you very much.
I really appreciate
enjoyed
it. And I'm Mabel Jong. Thanks for watching.